Hi, my name is Sydney Nikolai. It is July 16th, 2024. This is my note card, and I'm going to be doing my final presentation on compartment syndrome. First, what is compartment syndrome? So compartment syndrome is an increase in pressure within a space that compromises circulation, function of tissue in that space, and the nerves. What is a compartment? Um, I personally think of a compartment in like the lower limb typically. So in like the calf, you have like an anterior compartment, a posterior compartment. So a compartment is just a area of muscle, blood vessels, veins, arteries, all contained in thick fascia. So it's all kind of one unit, and it's discussed clinically as one unit of the compartment. So next, what is the classification of compartment syndrome? It can either be acute or chronic. Acute compartment syndrome is very, very serious because you can lose a limb, essentially. You can lose function of the limb. In chronic compartment syndrome, this is when you have an increase in pressure in one of the compartments of your body, typically in the lower limb is where we see this most, and you have an increase in pressure during exercise, but it decreases after the athletic exercise has completed. So once the patient is laying supine, usually with their legs elevated, the pressure will decrease and it is no problem. It just needs to be monitored. So the etiology of compartment syndrome. So it can be caused by an injury to the compartment or repeated stress to the compartment. There's a lack of blood flow to the area in the fascia, and this can cause nerve and tissue death. So again, a very serious complication. Personally, I'm going to discuss where I've seen compartment syndrome. So as a physical therapy technician, we had a patient who had a knee replacement, and they were having a lot of increased pain that was not relevant to and like expected as far out as they were from their surgery. So it was very swollen, and the physical therapist wanted them to go into the emergency room to make sure that their compartment syndrome wasn't at play, because there's nothing you can really do in physical therapy for compartment syndrome. Again, it's typically an acute condition. So they sent them to the emergency room, and they did in fact have compartment syndrome. What syndrome is this? So it's a musculoskeletal system, and it's a clinical emergency. There's many clinical manifestations of compartment syndrome. So first I'll go over the symptoms. So severe pain out of proportion to the initial injury. So again, I will connect this back to the patient that I saw. They had a knee replacement. I think they were around 8 weeks out from surgery, and they were having severe, severe pain in the calf region. So this is the posterior compartment. So sent them to the emergency room, confirmed compartment syndrome. So that severe pain, that doesn't really align with how the injury should play out. Pain that doesn't go away with medication and elevation. So because there's so much increased pressure, something such as ibuprofen or Tylenol isn't going to be very effective, and as it should be and should be expected to be. Swelling and bulging in the area, numbness and tingling because of all the increased pressure, pale or shiny skin. The patient can also feel a lot of tightness that doesn't go away with stretching, and typically the pain increases with stretching because, again, there's so much pressure. It's not like stretching the muscle is going to help decrease the pain. There can also be a faint pulse, and the patient can also feel like they can't move their muscle and the limb that is compromised. Some signs that the clinician may see for compartment syndrome are pallor, which is a pale area, pain, paresthesia, pulselessness. So when they try to measure the pulse of the area, it can't be measured because, again, there's so much inflammation, so much swelling, so much pressure, and paralysis in worse conditions. Diagnostic tests to confirm compartment syndrome. You can check the x-ray to see if there's any bone damage, an MRI when resting and exercising, to just compare and contrast and see, based on other values that are clinically available, to see if these align with compartment syndrome. And the kind of gold star way to diagnose compartment syndrome is a pressure measure. So how this works is they anesthetize the area and there's a needle connected to a pressure monitor. So they insert the needle into the muscle belly of the affected area and they take a measurement before and after exercising. So if you have the patient lying supine, just relaxed, they will have a number higher than 15 micrometers of mercury, so higher than that. Then you have them exercise so they can walk or run on a treadmill. And if it's higher than 20 micrometers of mercury, that means that they are most likely suffering from compartment syndrome. So I found this very interesting, and this seems like the best way to diagnose, but it can be very painful for the patient. Differential diagnoses, shin splints are one because it can cause similar pain, but a DVT, a deep vein thrombosis, can cause blood clots, which will decrease blood flow to the area and cause the compartment to swell and have increased pressure. Complications with compartment syndrome, necrosis of the tissue because there's a lack of nutrient, blood flow, oxygen going to the area, loss of nerve function, again, because things are being compressed. They can have, nerve signals are not functioning the way that they should in the compartment with compartment syndrome. Limb contracture, and then in very, very serious conditions, there can be renal failure and death. So compartment syndrome is a very serious condition, which I have seen clinically one time, and I most likely will see more often in my career as a physical therapist in the future. And knowing these signs and symptoms and how to diagnose it and what to do when you see signs and symptoms of compartment syndrome can be life-threatening for the patient if not properly handled. So thank you.